The intraop record is broken up into several segments, which are displayed on the left-hand side. Segments marked with an exclamation mark denote mandatory sections that must be completed on every case. However, any and all fields that are pertinent to your case must be filled out. Once a segment's documentation has been completed, a green check mark will appear next to the segment name. The documentation for each segment will display in the window on the right. Documentation can be done through selecting radio buttons, completing date or time entry fields, or by choosing options from a series of drop-down menus. Each segment also contains a free text box where you can enter in comments as needed. The previous and next buttons at the bottom right-hand corner will help you move from one segment to another. Selecting Next will also save your documentation for the segment. Next to the Documentation tab, there is a second tab called the Pick List. The Pick List is where you will need to document all items that were used for the case. The physician or procedure preference card should populate the pick list with all the supplies typically used for that procedure. This list will be referred to multiple times during the case. You can toggle back and forth between your documentation and the pick list by selecting the appropriate tab. The main areas you will be charting in will be the used and wasted quantity columns. To enter in the quantity used, right-click on the procedure and select the Use option. This will fill in the quantity of each item typically used for the procedure. To move through the numbers in each section, select the first item in the column and then use the down arrows to scroll through the list. If a change in the amount is needed, simply type in the correct amount and choose Enter. Occasionally, you will need to search for and add supply items that were not in the original pick list. To look for a supply, select the ellipses button at the top right-hand corner to open a search box. There are several different filters you can choose from to search for an item. After entering in the item number or description in the search field, selecting the Find Now button will display a list of available items that match your request. After selecting the desired item, choosing OK will add the item to the box at the top of the screen. Selecting Add will place the item at the top of the pick list. From there, you can fill in the quantity used as previously instructed in this video. Let's move back to the Documentation tab. The Case Time segment is the default starting point for your intraoperative documentation. As the name implies, all of the case times will be documented within the segment and includes the time the patient entered the room, the procedure start and stop times, and when the patient leaves the OR or procedure room. To enter in date and times, you can either type in the correct information or use the up and down arrows. A calendar is also available. Selecting the Next button will save your documentation and allow you to continue charting. The Case Attendance segment is next. This section is where you are to document all the people who are in the operating room during the procedure. You will need to chart their times in and out of the room and their role for the case. To add a provider, enter all or part of their name in the Case Attendee field. Selecting the magnifying glass to the right of the search field will open a new window displaying available providers who match your search request. After selecting the appropriate provider from the list, selecting OK will return you to the previous screen. You will then need to select the provider's role for the case by selecting the appropriate option from the drop-down menu. The time in and out will default to match the times the patient entered and left the room when the case is done. If the provider was not present for the entirety of the case, you must change the date and times as needed. Lastly, the procedure the provider was present for must be checked. To document the attendance of additional providers, select the Add button. Repeat the previous steps until all those in attendance have been added. To save your documentation and continue charting, select the Next button. The Safety Checklist sign-in is to be performed on all patients upon entering the OR suite. Fill out all fields as appropriate. Unlike the previous segments we have discussed, the Safety Checklist has more than one page to be documented within. You can identify which segments have more than one page by looking at the bottom left-hand corner. You can navigate between the pages by selecting the page number. Selecting Next will also move you to any additional pages. Please note that all pages within a segment must be addressed. The Safety Checklist Timeout segment is next. The purpose of the timeout is to prevent never events such as performing a procedure on the wrong patient or wrong site from occurring. The timeout is performed just prior to the first incision or start of the case. Chart the date and time the timeout was performed, and then document all those who had participated. Participants can be added by selecting them from the drop-down menu options. You can use the arrows between the boxes to add or remove participants. Continue charting the timeout information by selecting the items that are applicable to your case. Selecting Add and then Next will move you on to the Communication segment. Any communication with a family is to be documented within this segment. Document the communication type and who performed the communication by selecting the appropriate option from the drop-down menus. Be sure to enter in the correct date and time. Any comments regarding the communication can be entered in the free text box at the bottom of the screen. It is recommended to time the entries of each comment for future reference. Choose Next to save your documentation and move to the Surgical Procedure segment. The scheduled procedure will automatically populate within this section. In the event the procedure is not listed or needs to be changed, you can type in all or part of the name in the procedure field. Select the appropriate procedure from the drop-down menu options. Modifiers and other procedural details can be added if needed. Continue to fill out the rest of the segment. Remember to document the appropriate wound class, anesthesia type, and surgical service for the case. The time and date should again default from your previous entries. If more than one procedure is performed during the case, they will need to be added within this section. It is important to document any additional procedures as each one is reported individually for surgical data. Any procedures entered in this segment will also be recorded in the patient's surgical history and will not need to be recharted if the patient returns to the clinic or hospital in the future. This can be done by selecting the Add button. Complete the sections as previously instructed. Since there can only be one primary procedure, you will need to select No under the Primary Procedure section for each additional procedure. To save your data, select Next.